I have tried to summarize the view and the vision of from primary care on this. I think that this is a very exciting development. It's also a very sensitive one, and it's very good that we are firmly aware of where it's landing, what the context is and where it's landing. And one of the issues I think we should be better anticipating on than being caught with is the big discussion we see in medicine, particularly in medical schools, of person-centered versus personalized. And if we are not carefully addressing this, an agenda like this might be hijacked by medical technology on the very exciting, but in my view, pretty limited agenda of personalized medicine. On the other hand, I think the big issue is that you can only have personalized medicine when you apply that in a context where the person with the problem, the health problem, the disease, whatever, is at the center, because the personalization is part of a larger contextualization of healthcare. So it's a threat, but it's an opportunity at the same time, and it's probably an issue that needs good addressing beforehand, before we find ourselves running behind a large amount of technology that's going to live its own life. And with it, I think it's important to stress what is coming forward from these conferences 5 years in a row, that person-centeredness asks for a personalized, person's involvement. It's not a technology, it asks for a relation in which it is applied. And of course, in that relation, application of techniques or methods are probably very highly valued, but it's the dominance should be the personal relation in which it's all embedded. That's the part of the professionalism that we want to strengthen, and that's what we should keep our eyes on. And in that, I think also, is this just the personal relation between a patient and a doctor, or is it part of a larger supportive field? And primary care is very strongly promoting that this is a team approach, but it's also a community-oriented approach, and we have personal relations with communities as much as with individuals in their care, and that is something that should be taken care of. So in fact, and this is a picture I've taken from a major grant application we just made on a program on person-centered and personalized healthcare of the Netherlands School of Primary Care Research. This is bringing together a quite high complexity of relations, frames of reference, and issues that will interact. And I don't think we have to go through this picture as such, but it's just to illustrate the complexity in which we work, and it should be given credit to the complexity in which we operate. And in as far as primary care, family medicine is concerned, there is this quite obvious, there is a relation between a person, a physician, and a person, patient, but both have their own backgrounds, that context, and that should be taken care of. And when you're addressing the issue that, well, when you address diseases, you may have passed the point of prevention. Well, that is true for the patient as such, but with our concern about families, there might be a very important preventive agenda at the same time. So don't rule out prevention, but highlight, I would say, particularly personalized preventive possibilities that will be made possible through this method. So I would like to conclude with what I think is the traditional model that do-gooders think of when they're addressing primary care, whether it is research or it is educational training. The idea that you present knowledge to practice, a knowledge-hungry practice that is very, very eager to embrace that knowledge and go with it. And the practice, the reality is that more often than not, this is not the case. But at the same time, there is an awful lot of empirical wisdom, particularly in person-centered and population-centered healthcare. There is a lot of empirical wisdom, which, as its weakness, has never been disclosed, formally tested, or worked out, but is there to be taken benefit from. And the exercise we are doing in primary care for a great number of issues, and probably valuable here, is to connect this, the academic world, with the practice world. And conferences like this have the great potential to do exactly that, provided there is sufficient, the voice from practice can play a role, and that might be the context in which person-centered and people-centeredness can get a big benefit. And then, if I may conclude, my last point to make, quite often we see ourselves in primary care in a huge exercise with many specialists, and each subspecialist has to be taking place. Quite often we find ourselves the one voice of primary care against the 50 of subspecialty medicine, which is, at least it's not a very equal dialogue. It would be important to give credit in such meetings to not to lose the voice of practice, even if that's a minority in the room, because in the practice, in real life world, that's the majority. So with that, I hope I've given you a couple of critical points, but I think this is a very spectacular and very exciting development, for which I really thank you for your vision and for your tenacity.